Welcome to Unit 8, Substance Abuse Disorder. This is my favorite lecture by far. We are going to talk about substance-related disorders, substance abuse, and what you see in substance. We start off with a whole bunch of new words that honestly, from class, I'm sure you're all aware of this, there's only a little bit of difference between the meaning, right? So substance, what are you abusing? It could be anything. Substance use, you're taking that substance and you're injecting it and it's affecting the body. Abuse substance, it's going to alter your perception by affecting the central nervous system. Substance or drug abuse, excessive use that differs from societal norms, right? Y'all were shocked when we talked about what is a drink. You have that one glass of red wine and that's great. You have 3 bottles of red wine. It is now substance abuse. Denial, we know that from like 3rd, 4th lecture, right? I don't have a problem. Habituation, you need that substance for pleasure or relief. It could be, right, habituation could lead to addiction, but habituation by itself could be, I can't sleep unless I take melatonin, right? It doesn't have to be anything crazy. Please forgive my dogs who are coming in chasing each other. Substance or chemical dependency, you have to take your dose of the medication, of the drug, to prevent withdrawal. If I go more than, 6, 7, 8 hours without a glass of wine, I'm going to start shaking and become hypertensive. Chemical dependency. Addiction, there is a physical dependence on the substance. Abstinence, you stop using, hold on, can you close the back door? You stop using the addictive substance. Detoxification, the process of removing the substance from your body, right? You have so much alcohol, it takes time to actually get the alcohol out of your body. So we're going to spend 7 days and slowly get it out of you and start to get you stable. Intoxication, when you're under the influence of the chemical. Tolerance, you need more and more of the chemical to produce the same effects. Physical tolerance, your body's adjusted. You see physical a lot with alcohol, right? Because your liver is involved. Your liver can process that alcohol super fast and you get rid of it and you can drink more and more and more. Psychological tolerance is where you start to see the addiction because that's that brain involvement, right? I drew my really bad squigglies on the board. Let's see if I can do this right on here, right? You have baseline. And then the more and more you do your drug, right, we're going to bring that dopamine up and down and up and down. And we're going to need to do more and more of the drug. And eventually, you're running way down here with your dopamine when you're not doing the drug. And that's what you see. Oh, this is really annoying. And where you see that psychological tolerance. It's the dopamine. It's the gabapentin. It's the norepinephrine. And that is what is going to produce most of our struggles when we look at addiction. Never doing that again. Okay. It's not changing slides. No, substance abuse and age. No safe drugs at any point in time, right? Even fetuses use substances. Excessive alcohol use results in fetal alcohol syndrome. Smaller heads fail to develop normally. They have a slow growth rate. Alcohol use in pregnancy is a leading cause of preventable developmental disabilities. Infants exposed in utero to cocaine have trouble sleeping, and they have eating problems, and they have an unusual high-pitched cry. Children are going to use substances, and they're going to be legal and easily available. Whippets, right? Whipped cream cans. Got to be 21 to buy them in New York. Adolescents, alcohol is the most frequently abused drug. It's common for adolescents to experiment with drugs. They may use it in social settings, sometimes for relaxation, help with anxiety. If a teen is using drugs and they are struggling with addiction, they're more likely to become involved in other illegal activities. 6% of the adult population in the U.S. reports heavy drinking. 17% report regular binge drinking. Cocaine is more used frequently among African Americans, while white and Hispanics prefer alcohol and methamphetamines. Substance abuse has many costs. We talked a lot of those statistics. A lot of people die. Just considering adolescents, remember 2019 to 2020, mortality from overdose, so people likely to die from overdose, increased by 94%. And fentanyl accounted for most of them. Have a ton of different types of abuse chemicals. And we're not even going to talk about all of these in the class because we just don't have time. Opioids, narcotics. Opioids and narcotics are the same thing. Heroin, morphine, hydromorphone, fentanyl, stimulants, amphetamines. Some of these are all the same thing, just different names. So what do you see? We're going to go through all these, right? Alcohol, CNS depressant. Narcotics is a CNS depressant. Stimulants are going to stimulate the CNS. Hallucinogens, LSD, PCP, cause psychosis. Cannabis, designer drugs, your ecstasy, MDMA, Molly, Rohypnol, GHB, mild hallucinogen. Any medication, right? Anti-anxiety, sedatives, laxatives. Imodium is a highly abused medication. Inhalants, solvents, aerosol, propellants, nitrous oxide, poppers and snappers. I have never heard poppers or snappers, but apparently that's a type of inhalant that we use. So what's in a drink? This is a standard drink, right? So 1.5 ounces of 40%, 80 proof. 5 ounces of 12% wine, 8 ounces of a 7% malt liquor, and 12 ounces of a 5% beer. So if you're having a huge, massive beer, you are having more than one drink. If you go out and have that massive margarita, that could be 3 drinks in one. Okay, so when we talk about alcohol, the effects in the body, it's a CNS depressant because it's going to depress GABA. GABAs are inhibitory neurotransmitter. However, to counter that, serotonin and norepinephrine are going to get out of whack to balance things up, right? Serotonin looks about mood, cognition, reward, learning, memory. Norepinephrine increases alertness, arousal, and attention, right? It's going to constrict blood vessels, which help maintain blood pressure, affect our sleep-wake cycle, mood, and memory. So look at all these different things that can happen because of alcoholism, right? Cirrhosis, hepatitis, pancreatitis, stomach ulcers, vomiting, right? GI bleeds are huge. Symptoms of alcohol withdrawal. You have mental symptoms and you have physical symptoms. Headache, nausea, vomiting, abdominal cramping, tremor, seizures, loss of appetite, heart palpitations, high blood pressure, fever, sweating, trouble breathing, and delirium tremens. Right? Insomnia, fuzzy thinking, fatigue, confusion, anger, irritability. A ton of them. And it goes over time, right? So from the point in time that blood alcohol gets to 0, or honestly close to 0, because some people, they can't let it ever get to 0 or else it already is bad, you see mild symptoms, right? 12 to 48 hours, and everywhere you look, these hours are going to be different. But somewhere about 24 hours, moderate symptoms, and 2 to 3 days, severe symptoms, hallucinations, confusion, agitation, seizures, delirium tremens. Right? Delirium tremens is a medical emergency. And it can cause a person to die. Like, this is what causes people to die from alcohol. Problems breathing, poor circulation, body temperature, high heart rate, high blood pressure, decreased blood flow to the brain, and severe dehydration. We don't want patients to detox at home if we know, depending on how much they've been using and where they are, because it can lead to delirium or tremens. I just think post-acute withdrawal syndrome is something good to know. Y'all will not be tested on post-acute withdrawal syndrome. So how do we know how bad someone's detoxing, especially from alcohol? We're going to do a CWA. We're going to ask about nausea and vomiting. We're going to ask about their trevor. Hold their hands out and see how much they're shaking. I can never say this word. Paroxysmal sweats. Are they sweating? You're going to see it on the palms. You're going to be able to see it on their forehead. They're going to be soaking their bed at night. Anxiety and agitation. All of those things combined are what's called a CWA, and it tells us how bad the detox is. Antabuse is one of the main medications we see per your book for addiction. It's from alcohol. It's taken daily. When a person consumes it, it makes them violently sick. So we need to avoid anything which may have alcohol. Aftershave, mouthwash, cough syrup, lotions. because ingesting or even putting it on your skin can cause intense headaches, flushing, nausea, vomiting, hypotension, and blurred vision. But what's the problem? When you want to drink, you just stop taking it. And then 2 days later, you go out and you're drinking, and it's like it was never happened. Narcotics or CNS depressants, right? Natural, semi-synthetic, or synthetic. Opium, morphine are natural. Heroin, hydromorphone, and therbane derivatives are semi-synthetic. Your complete synthetic are going to be your fentanyl, right? And these chemicals of abuse, these narcotics, they produce a euphoria. They make you happy. Opioid overdose, unusual sleepiness or not able to wake up, slow or absent breathing, slow heartbeat or low blood pressure, cold and clammy skin, tiny pinpoint pupils, and nails and lips are blue. Right? And treatment for that's Narcan. We can give it intranasally. We watched that video about it. Sub-Q, IM, or IV. You're going to use different things, whether you're in the hospital or you're out. So we watched these videos on Narcan. Forgive my family in the back. So heroin. Heroin is made from morphine. White or black powder, sticky, right? You got your sticky tar, known as black tar heroin. It's usually cut with other substance. Everything is. Injected, smoked, sniffed, snorted. And you get a feel of euphoria or rush when you use it. Signs of abuse are constricted pupils, drowsiness, and depression. Right? Overdose is going to be similar to any other type of opiate. Methadone is similar to heroin, except it's used to treat opioid addiction. It prevents symptoms of withdrawal, but it's addicting, so patients have to go and get dosed daily. Chemicals of abuse, stimulants, caffeine, cocaine and crack, prescription drugs. Someone in my house has given me a look when I talk about caffeine, about a chemical of abuse. Amphetamines, appetite suppressants, methylphenidate, Ritalin. Right? So your patient's own medications. And sometimes your kid isn't your pediatric patient is not getting their Ritalin because their parents taking it. So chemicals of abuse, stimulants increase the function of the central nervous system. Caffeine, found in many products. A cup of coffee is about 80 milligrams. Max for the day should be about 200. Overdose can cause death. Intoxication, restlessness, nervousness, rambling speech, high energy, agitation, muscle twitching, rapid heart rate, increased heart rate, and hypertension. Withdrawals, headache, sluggishness. Caffeine withdrawal is super common in American society. Cocaine and crack. This is cocaine in this picture right here. It's a stimulant. It's a powder, snorted or ejected, right? Again, produces that euphoric effect. Crack is made by dissolving cocaine in water and mixing with baking soda. It then forms hard rocks that are usually smoked. They're both highly addictive. Crack a little bit more so because you get a faster high. When cocaine is injected or smoked, the drug works faster and you get a faster high that's way more intense but does not last as long. When you snort cocaine, you take longer to feel the effects, but they last longer. So depending on how someone is doing substances is going to depend on how it produces results. Methamphetamine as a stimulant, right? Crystal meth looks like glass, bluish white rocks. It's used in a binge and crash pattern. It's chemically similar to medications for ADHD, right? A run, taking the drug every few hours for up to a few days to stay awake. It affects dopamine and causes paranoia and hallucination. Short-term effects can result in many of the same health effects as other stimulants. Increased wakefulness and physical activity, decreased appetite, faster breathing, rapid or regular heartbeat, increased blood pressure and body temperature. But long-term weight loss, dental problems, itching, right, skin sores, anxiety, changes in the brain structure, confusion, memory loss, sleeping problems, violent, paranoid behavior, and hallucinations. When someone is intoxicated in a substance, look at the opposite of those symptoms, and that's generally what you see when someone's withdrawing and detoxing. So there is really methamphetamine, right? when they're coming off of it, all they're going to do is want to eat and sleep. And they're going to eat and sleep a lot. Cannabis, derived from the hemp plant. Marijuana is the dried tops of leaves. Hashish is the resin that seeps from the tops. Hash oil is distilled hashish. Right? They alter perception, short-term memory, concentration, increase hunger. Large doses can cause anxiety and paranoia. And while all of you argue with me, you can withdraw from it if you've been taking large quantities or even not large quantities, and it can cause an anxious mood, irritability, and disturbances. Because let's face it, right, the opposite. When you're taking cannabis, you're super calm, you're chill, you're relaxed, you might be eating and sleeping more. So when you withdraw, it's the opposite. We didn't talk about this in class, and I realized I put this here. It's legal in several states, but federally it is still illegal. So pay attention if you travel out of state and you ever want to use it. Hallucinogens, natural and synthetic substances that alter one's perception of reality. The same, right? Perception of reality, the same definition we had for psychosis. Psychosis is an alteration in one's reality. Hallucinogens cause psychosis. Peyote, LSD, psilocybin, magic mushrooms, PCP, everything from mind-expanding experiences to bad trips. Signs and symptoms: ataxia, hypertension, repeated jerking movements. PCP, table 28.2 in your book, very good to know, right? This is PCP here. It could be a pill. It's usually a crystal white powder. Increased blood pressure, muscle rigidity, jerking movements, weight loss, nystagmus, right? Belligerence, delusions, hallucinations, distorted thinking, poor judgment, impulsive behaviors, paranoid, unpredictable behavior. That's like reading a text from schizophrenia. Minor drugs are made in a laboratory, right? We take another drug and we alter it. MDMA is ecstasy, also known as Molly, STP, ice. These are popular in nightclubs and in raves because in some ways they're stimulants and they keep you up. You have increased energy. There's a lot of like emotional warmth. People just kind of feel like they're falling in love with everyone. Nicotine, all forms of tobacco has nicotine. Relaxation, increases alertness, helps relieve feelings of hunger, highly, highly addictive, and causes lots of health complications. Y'all should know this already. Inhalants, volatile substance or chemicals like gasoline that are inhaled for their effect. Poppers, nitrous oxide, aerosols, solvents. These are tons of different definitions of different types of things that people can use. Felt tip markers, paint thinner, whipped cream, right? Refrigerants, vegetable oil sprays, hairsprays. However, taking these coma, sudden death, respiratory depression, hyperactive motor responses, loss of coordination, and seizure. And that can be with the first use. The first use can cause a coma. You can die from cardiac complications the very first time you use a popper or a whippet, whatever we're calling it. Characteristics, multiple different theories, right? Biological, variations among ethnic and genetic, biochemical is going to explain it. Psychological, personality and emotional problems or causes. Environmental, right? The individual, the family, social culture, surroundings may be causes. If you grow in a family of people who abuse substances, you have a higher risk of abusing substances. Stages of addiction, right? It starts with preoccupation. Me and my caffeine, we talked about this in class, I cannot wait to have a cup of coffee. I am almost ready for my 5 o'clock cup of coffee, right? And I'm going to anticipate my cup of coffee and I'm going to think about my cup of coffee. And next thing you know, I'm not having a cup of coffee. I'm having 3 or 4 cups of coffee. My little tall went to a grande, which went to a venti. And I'm taking more and more and more and more to feel the effects, right? Tolerance, withdrawal. Well, the coffee doesn't do anything. Let me move on to straight shots of espresso. And then when I stop having the caffeine, I'm going to have withdrawal. I'm going to have that headache. I'm going to feel crummy. I'm going to feel miserable. And I'm going to need withdrawal to go through it, right? When we go through treatment, patients are going through these stages. Usually they are at that binge intoxication when they come in, and we have to detox them, right? We have to remove the substances from their bodies. before we can start treatment. Criteria for diagnosis. Pattern must be disabling, lead to impairment of function and distress. You must exhibit tolerance, withdrawal, and dependent signs. Interventions. We have to do a full assessment. This is medical. Nursing, more so than psych. You have the psych component, but we're concerned about seizures. We're concerned about comas. We're concerned about heart rate and respiration. What are we going to do for treatment? The disease model views it as a disease that has to be treated as a disease. The next treatment therapy is the 12-step, right? They admit they're powerless over control of drug use, and they seek help from a higher power, not necessarily God. Medical model looks at it. It's a public health, right? Addiction is a chronic disease, just like diabetes. And we have to view it as such. Psychiatric model. Abuse is an expression of an underlying emotional conflict. I struggle with anxiety. If I take a lot of benzos, I don't have my anxiety anymore. Social culture, related to the environment. Guidelines for relapse. The reoccurrence of substance abusing behaviors is after a significant period of abstinence. Clients who have relapsed may feel many emotional distress. One of the things if you talk to anyone who has struggled with addiction, they would tell you once an addict, always an addict. So we need to, when we talk about like nursing diagnosis and therapeutic process, right? One of the things we need to consider is if you have a patient who has a history of opiate addiction and they come in and they're having surgery, do we send them home with a whole bunch of opiates? Nope, we find something else to do. Can we send them home with a nerve block? Right? Is tramadol sufficient, right? Maybe if they just do 800 milligrams of Motrin. We have to find something else because re-exposing them to that opiate can be potentially dangerous. Substance abuse in general is challenging and frustrating because relapse is high, and we want the best for all our patients. But just like everything else, when it works out okay, it's rewarding. If y'all have any questions about substance use or addiction, please reach out and let me know.